Welcome back. You're still watching World Insight. I'm Tian Wei. We continue our discussion on COVID-19. The number of confirmed cases has now passed almost 2.5 million globally. Over 170,000 people also died. Yet the WHO has warned that the worst is yet to come. Lately, we have talked to Martin Jacques, a senior fellow at the Department of Political Science and International Studies from Cambridge University. He's also author of the book When China Rules the World. He gives his opinions on the performance of governments and governance around the world in coping with the challenges of COVID-19. Tell me more about your reaction to the U.S. decision to halt WHO funding.
Well, I mean, unfortunately, it's not surprising because we know that Trump is capable not only of the unexpected, but also in a sense the predictable, because his view of the world is America first, and so he's not really bothered about other nations and what other nations need. He's just bothered. Basically, at the end of the day, this is a decision based on his desire to win the next presidential election in America. So it's a complete abdication of any kind of responsibility to the world.
So are we going to be, in a way, delayed as a result of the action from the U.S.? What does it depend on?
The only way we're going to be able to deal with this successfully is by global cooperation, not one nation on its own, but nations together, because we're not out of the woods yet in relationship to this. It could outbreaks could go on, further outbreaks, second, third. We don't know how the virus might mutate over time. So it's absolutely vital that we have collaboration. Now, the danger is that if America suspends its funding, it's a very significant funder of the WHO, then how is that going to be made good? But in a wider way, probably, and there's optimistic noises coming from the WHO about how they're going to handle this action by the Americans. But generally, it creates an area of confusion, of conflict, of distraction, which prevents the world concentrating on what it needs to do. There are two things that need to be done. One, countries need to concentrate on handling the outbreaks in their own territory. And secondly, cooperating and learning from each other.
As clear as that, these are the priorities. These should be the most important tasks. How confident are you the next step?
Well, I'm not so confident. I mean, I think we just have to be relatively pragmatic while also thinking strategically about the future. But pragmatically speaking, countries are wrestling with the spread. So, I mean, it looks possibly as if Europe is just beginning to turn the corner, but let's get too optimistic about that. I mean, the worst cases have been Italy and Spain, and they seem to maybe peaked. The UK situation is very serious. And of course, the American situation, which is the worst in terms of the number of deaths, is, the trouble in the American situation is not least the polarization of American politics means there's not been a proper concerted actions. I mean, New York's been handled well by Cuomo, relatively well, I think. But, Trump's always pulling in another direction, speaking to a different audience, the audience he thinks is going to elect him in the presidential election in November. So I think that and the other thing that must be added here, and I think this could be absolutely critical next question, which is what is going to happen to the developing countries? What's going to happen in East Asia, for example, in Indonesia, in the Philippines? What's going to happen in sub-Saharan Africa? These countries have got very weak health facilities, very low proportion of doctors in the population. So that could be a big problem, because then you can have easily a kickback effect from the developing countries back into the relatively rich countries. So we don't know the end of it. The story is not finished.
And we're seeing many of those cracks right now. The question really is, Mr. Jacques, are our lives going to be sacrificed as a result of the US presidential election? All of our lives?
Well, I think that Trump is really only interested in one thing, and that is his re-election. It shows you, Trump shows you how dangerous it is if you get the leader of the United States simply playing to a section of the American population with which he has some kind of affinity, some kind of resonance, and their interests and their prejudices are placed above those of the rest of the United States, which is at least half the United States, and the rest of the world. And that's the situation. That's the dilemma the world is faced with someone like Trump being the president of the United States.
We have noticed that you've been observing very closely since the very beginning of the pandemic. I mean, COVID-19 being pronounced by the WHO as a pandemic. The governance style, quote unquote, of the East and the West. Tell me more about your observation results.
Well, I think there have been very marked differences, actually. I mean, if you take East Asia, by which I mean China, Vietnam, South Korea, Singapore, and so on, they've all handled the virus pretty successfully, relatively speaking. I mean, this is a completely new phenomenon. China always is confronted with an unknown. It couldn't look elsewhere. It had to understand it itself, and so on. And I think basically they've acted very well in these countries. Once they realized just what a great danger it was, with great effect. Why? Well, I think that's got culturally, it's not just a political question, it's a cultural question as well. That's to do with this strong relationship in Confucian-style societies between the state and the individual. The state and the individuals expect governments in these countries to give a lead. They expect governments to take the initiative, and they will respond, and people will respond in a very orderly and a solidaristic way. Now, in Europe and the United States, I think it's much less like that. It varies across the different countries. They're not all the same, but the tendency there has. I mean, this kind of relationship between state and individual is much more distant, and therefore it's not just that individuals don't react in the same way, it's that the state is disinclined to intervene in this way. So, if I look at my own country, really the idea of the lockdown was, very, very slowly adopted by the government. It was reluctant. It moved really relative to the urgency of the time in a snail-like way, a snail's pace to react to the situation. So I think that certainly to deal with an epidemic of this kind, by and large, I would say countries like China, Vietnam, the ones I listed earlier, have been able to deal with it much more effectively. And you can see that in the death. I mean, the figures for the numbers that have died show that difference. Of course, the other extreme on the Western side is the United States, where the attitude towards government in the United States is, in the popular view, is to keep it at arm's length, to keep it at bay. The state is a problem. The state is even an adversary, an enemy. So therefore, to get effective action is much more difficult. And that is complicated by two other factors, and that in the United States. One is the federal system. So there's the states on the one hand and the national government on the other. And the other problem is the deep polarization now in American politics, which really, in some degree or another, paralyzes or greatly undermines the capacity to do things.
Yeah. Mr. Jacques, one of the things we're talking about is we have to understand pandemic. Pandemic is something that you have to react quickly and otherwise it could grow with exponential speed. Whether you're talking about cultural factor or governance styles, are these questions relevant in face of life and death?
Actually, my guess is that we're still at the early stages of this, by the way, because most people live in the developing world, and so it's reached the developing world later. China, and then East Asia, and then Europe, and then the United States, North America, and so on. But it hasn't, it's only now really taking hold in India and in sub-Saharan Africa, and so on. And I think that, those figures that we've got at the moment are, I fear to say this, but I think maybe are only the first phase or first and second phase of what we're going to see. It's going to become, I think, very, very serious.
How do you see the responsibilities governments has played so far during this stage of COVID-19? I'm not saying the next stage, but this stage so far. Are they disappointing? Should we be optimistic? What can we expect? Can we expect them to change for the better? Your assessment.
Well, I think the word you use, disappointing, is the most accurate one. China took drastic action and was, I think, brilliant in that phase from around about the 23rd of January, the lockdown in Wuhan and so on. But you've got to look at what the reaction in the West was. The reaction in the West during the course of January was basically to say about China, you're covering up, it's all about secrecy, you're not being honest, you're not telling us, you're not being honest with your own people, the government's only interested in its own survival, it's not interested in, Chinese lives and so on, all this kind of thing. It was aggressive. The response was very aggressive. It was a real anti-China assault in the course of January. We mustn't forget that or misunderstand that. It was like that. And the result of this, I think, essentially, was that people, the governing classes in the West, didn't think this could reach them, that it could affect them. They thought it was a Chinese problem, and they therefore totally misunderstood the significance of coronavirus and thought that it was confined to a Chinese problem. They learned nothing. They had 2 months to prepare. They didn't prepare. The one great exception in the West, in my view, is Germany. Germany has done, it seems to me, an excellent job. It really thought about it, and it clearly learned from East Asia. It had watched East Asia. It had got testing, the necessary testing things together, and they've done a wonderful, relatively speaking, compared to the rest of the West, a wonderful job of testing and so on. But what this tells me is that, the difficulty, the whole response to the pandemic has been colored by the political differences or attitudes towards China in the West, which have seriously weakened the Western response. They didn't learn because they thought they would never be affected. If this was hubris, this was arrogance, on the Western part. And we in the West countries are paying a big price for this. Now, what we need in this situation is, global cooperation. Now, I'd like to make one exemption to this, and that is this: you don't hear the scientists in the UK, for example, criticizing China. You hear them saying, well, that they're abreast of a lot of the Chinese medical literature on COVID-19. They quote it. They seek to learn from this evidence. This is the kind of relationship. This sets an example, it seems to me, of what the relationship it should be between countries and between medias and between national governments.